Good afternoon. My name is Nina Kulminskaya. I am a doctor, resuscitator and medical consultant of Triton Company. Today I will talk about additional functions of intensive care ventilator MV200. Additional features of the ventilator include sound alarm off, stops all alarm up to 120 seconds, oxygenation, suction, standby mode, alveolar recruitment maneuver, leak compensation, manual breathe, screen lock, and freezing. There are three ways for work with additional functions: from the quick access line on the main screen, from the main menu, and with a button on the front panel. Oxygenation. Press oxygenation button and 100% oxygen is provided for 2 minutes. Field of oxygen concentration becomes yellow and shows the time left before the end of oxygenation. At the second clicking on this field or icon, oxygenation is disabled. Suction. Sanitation function makes the sanitation of the tracheobronchial tree more ergonomic. After activation of the sanitation function, oxygenation is performed for 3 minutes. At this time, the ventilator waits for disconnection of the patient. After disconnection, the device stops ventilation. After connection, the device continues ventilation. If connection does not appear within 2 minutes, the device activated sound alarm. Standby mode. Press encoder. Enabling on standby mode leads to stopping the ventilation, blocking of all alarms, and active additional functions. You can correct ventilation parameters before continuation of ventilation. Just use ventilation parameter, and to continue ventilation, press encoder or start button. Leak compensation. Leak compensation is used for ventilation when the tightness of the breathing circuit isn't available. In the case of the leakage, it is recommended to set one of the pressure-controlled modes. Leakage compensation is provided in all modes of ventilation. You can activate leakage compensation function here. So, tidal volume is increased by the level of leakage. PEEP level remains constant regardless leakage. Activation of leakage compensation function automatically increases the base flow for 10 liters per minute. If necessary, you can use the face mask in all modes with leakage compensation. Manual breathe. The manual breathe function, single mandatory breathe, is for diagnostic and treatment procedures. For example, X-rays and synchronization with nebulizer operation. Also, doctor can use only manual ventilation. Manual breathe is continued while we hold the button, but not more than 15 seconds. After 15 seconds, the manual breathe is stopped and ventilation is started with current parameter. Alveolar recruitment maneuver. Recruitment maneuver is used for opening of collapsed alveoli. The device has the simplest recruitment function by temporarily increasing of PEEP. It can be used for severe patients with ARDS. Recruitment maneuver is active only for continued mandatory ventilation with the controlled volume or pressure in inspiration. Enabling of function of impossible in the following cases: if set PEEP more than 25 cm water, if total pressure, including PEEP increasing plus 5 cm of water reserve, exceeds Pmax. If the SAI leak compensation or suction function is enabled. You can set the value of PEEP increasing from 3 to 25 cm of water. After clicking Start button, the recruitment maneuver starts and the icon changes its color. So upon activation of recruitment maneuver, the new PEEP value is set. PEEP current plus PEEP increasing. 2 breaths are performed. Then ventilation returns the current ventilation parameters. The maneuver is repeated every 3 minutes. For disable of recruitment maneuver, click on the stop button and the icon will change color to indicate this mode is off. The device automatically disables the alveolar recruitment maneuver at the transition to another ventilation mode. At the occlusion, disconnection, or apnea, the recruitment maneuver is also deactivated. After returning to current ventilation, the recruitment maneuver is active again. Screen lock. Press screen lock button. Yellow message touch screen is locked is displayed in the bottom part of the screen. During screen lock, data output continues as usual. Encoder sound alarm off button, alarms are not blocked. Press the encoder to unlock the screen. At pressing the menu Unlock touch screen, yes, no is shown. The doctor can choose necessary action. The freezing of graphic curves is used for analysis of respiratory cycle and for demonstration of instant values of curves. Press the freezing button. The color of icon becomes dark blue. Vertical marker line appears. It corresponds to the time of freezing. You can move marker line by encoder. Accordingly, the instant values are changed. At second clicking of icon, freezing is disabled. Screen brightness. You can change your brightness for day and night operation mode. Night mode of the display is switched automatically from 12 to 5 AM. By clicking on the icon, display mode is switched to the opposite, regardless of the time. Brightness can be set by menu, service menu, calibration, CRI and D, day brightness, and night brightness. The brightness of the day may vary from 100 to 50%. Brightness in the night mode varies from 100 to 30%. Nebulizer. You can use of pneumospray type nebulizers for the medicine inhalation. Connect the nebulizer tube to the nebulizer fitting. Connect the nebulizer to the breathing circuit. Set the desired time of nebulizer's operation in menu, additional functions, nebulizer work time, up all to 60 minutes. Turn on the nebulizer by pressing the encoder. During inhalation, the information message nebulizer is on is displayed by green color in the indication area. For earlier termination of the inhalation, select nebulizer work time all minutes in menu additional functions. Operation of nebulizer is possible only if the device is connected to the high pressure oxygen line. CO2 value some increases because spraying is carried out with oxygen. So it's necessary to consider an increase in oxygen concentration in air mixture. When using the nebulizer, it is recommended to disable side stream oximeter because occlusion can happen by medicine in the monitoring line. Thank you for your attention.